My name is Christopher Lee. I'm a radiation oncologist at Cancer Care Northwest, and I've been here for the last 14 years. So my interest in oncology dates back to when I was a child. My father's a chemist and did a lot of his initial research in looking for the compounds that are in our environment that cause cancer. And so when I was in high school and in college, I used to work in his research lab, and we were analyzing different ways that people develop cancer from pesticides or from different foods or different things in the environment. When I got to college, I continued research and focusing on those types of studies, and found that I had a love for taking care of patients with cancer. Found it very rewarding. It's an area where there are a lot of advancements, a lot of technology that's being developed, and changes happening all the time that further improve our ability to cure cancer and to provide better treatments, safer treatments for patients that we're taking care of. When I was in residency at the Huntsman Cancer Institute, I was focused on academic medicine. I had participated in some big research studies and had written some papers that helped us to better define cancer therapies for patients with uterine cancer and brain tumors and head and neck cancers. I was looking at academic jobs and found that this practice had a large emphasis on research, as well as focusing on individual patient care and helping to provide cutting-edge treatments for patients who were going through their cancer therapy here in Spokane. We loved the area. We thought it would be a wonderful place to raise our family, and so it was really a wonderful blend of those things that helped me to decide to come to Cancer Care Northwest. When I talk to patients, I try to emphasize, this is not the same cancer treatment that your grandmother went through, or that even 5-6 years ago. There are some areas now that have a dozen new drugs and treatments that are easier to take, that have better outcomes, improved cure rates, and tumor control rates for patients, that even when I left residency 14 years ago, they weren't even available. So it's an exciting area, and for me, I love being able to sit down with patients and talk to them about all of the options available, and to help them and their families decide what's the best option for their individual situation. For patients who are newly diagnosed, the key is to let them know that they have options. Sometimes patients come to us and they have all the fears and all the worries, and they're carrying the weight of the world with them when they come to those appointments. And my emphasis is that we're here for you, we're here to help. There's a lot of support, a lot of things that we can do to help to provide and to lift that burden as you're going through treatment, through the cancer therapies and the support staff, and really linking support that's available in the community, so that together we can help them get through and overcome these hurdles and provide treatment goals. I tell my patients, the important thing is to focus on what can we do today. And sometimes looking at the whole picture can be daunting and overwhelming. But as we sit down today, how can we help get through today and make decisions that are critical so that we can be prepared for tomorrow? It's very gratifying to be part of a wonderful collaborative team where we have experts who are at the top of their field, to be able to have the technologies that are on par with any leading institution in the country. I feel privileged to be a part of the Cancer Care Northwest team. Cancer Care Northwest is home.